All right. Well, good morning, everybody. This is Jeff Jaskunas. Before I get started, I just want to see if everybody is able to see the presentation slide deck now active on their screen. Okay. So I have confirmation there. So at this point, I'd like to go ahead and call to order and get started. My name is Jeffrey Jaskunas. I'm the CHP Plus Program Manager here at the Colorado Department of Healthcare Policy and Finance. We are meeting here today to discuss Colorado's demonstration extension application for its Title 21, Section 1115 waiver. This is entitled Adult Prenatal Coverage in Child Health Plan Plus, or CHP Plus. This meeting will be open until 1 p.m. this afternoon. During this time, I will discuss the state's waiver application. I'll provide an opportunity for anyone interested to present comments, questions, or topics for discussion to the state. I'm going to start out with a brief discussion of this waiver's application to the department's mission. Our mission is improving healthcare access and outcomes for the people we serve while demonstrating sound stewardship of financial resources. The Adult Prenatal Coverage and Child Health Plan Plus demonstration touches on many aspects of our mission. Specifically, it supports the improvement of health outcomes for low-income mothers and their babies by providing access to necessary prenatal delivery and postpartum care to eligible clients. For today, I have a few agenda items. I want to start with brief introductions. I will go into the background of the state's demonstration application. I will discuss components of that application, including the interim evaluation results from the present and active demonstration period. I will go through the stakeholder engagement and public comment feedback process for Section 1115 waiver applications. I will conclude with a discussion of the state's next steps to submit the application for consideration by CMS and federal comment periods. At the end, I will open up the forum for any interested individuals to participate in comment, discussion, or submit formal questions. I do want to ask a few general frameworks for us to hold this meeting in. I invite everybody to share openly with their unique perspective. While we are meeting virtually today, this would traditionally be an in-person meeting. We weren't able to hold an in-person public hearing due to the limitations that are currently present on social gathering within the public health emergency. I appreciate everybody's flexibility in joining in this forum to respect the social distancing required at this time. With that being said, I ask that everybody share and respect this space in the same manner that they would if we were meeting in person. In the event that you wish to share, I ask that you please state your name first, such that we're able to account for all individuals and properly log comments for additional responses and follow-up by the state. In the event that you're unable to share or do not wish to share in this forum, I encourage you to write down anything that you're unable to say, and at the end of the slide deck there will be an email address that you may submit your comments or feedback to. Before I go into the background on this waiver, I want to provide a few definitions, terminologies, and acronyms that you may see throughout, and that, while I will do my best to avoid stating, you might hear me say them. The first, which I've already mentioned, is Child Health Plan Plus. You'll see this often referred to as CHP Plus, and this is Colorado's combined children's health insurance plan. Additionally, the Children's Health Insurance Plan is often referred to as CHIP or CHIP. It is the Title 21 program referenced throughout this demonstration. It's a state and federal partnership. Title 21 and Title 19 are items that you will also see mentioned. Again, Title 21 refers to the Children's Health Insurance Plan. Title 19 is another term you'll see in here, which is in reference to Medicaid. Modified Adjusted Gross Income, or MAGI, M-A-G-I, you may see referenced in this presentation, particularly in some of the footnotes, and it is used in reference to the methodology currently used to determine a client's federal poverty level. The final item that I want to discuss and clarify are the terms waiver and demonstration. You will hear these both frequently throughout this presentation, and they are largely synonymous and interchangeable. I will be using them to indicate the topic of today's meeting, which is Colorado's Adult Prenatal Coverage in CHP Plus demonstration, or Section 1115 waiver. So with those out of the way, I want to run through the background of this demonstration. It's existed for quite some time. It started in September of 2002 when the state of Colorado received approval from the Center of Medicare and Medicaid Services for the first demonstration period of this program, which was a 5-year approval. Since then, multiple extensions have been granted, and the most recent renewal granted an extension to continue the program from August 1st, 2015 through July 31st of 2020. Given that this demonstration has existed for 18 years, it's reasonable to expect that several changes have taken place in the past almost 2 decades. And most of these have focused on changes to eligibility criteria, specifically the federal poverty level, that occurred for the demonstration, largely driven by changes that were made to Colorado's Medicaid state plan and CHIP state plan, such that the demonstration properly corresponded to the implementation of those benefit packages within the state. An additional change occurred with the implementation of modified gross adjustable income and its use in calculating the federal poverty level to determine eligibility criteria within this demonstration. This occurred just before the most recent extension application, which was approved in 2015. And the difference between pre and post modified gross adjustable income makes it difficult at times to go through the application's historical documentation and supporting material. So please be aware of that it is important as you're reviewing the documents posted on the state's website to keep track of any footnotes and make note of whether a given FPL percentage is listed as pre or post this methodology change. An additional and important change occurred in 2013, and it was done to comply with the Children's Health Insurance Program Reauthorization Act. often referred to as CHIPRA, and this transitioned the coverage of pregnant women that were previously enrolled in this demonstration or enrolled in this demonstration at that time to the Medicaid state plan. Pregnant women with incomes above the upper limit for the demonstration were transitioned to the CHIP state plan. The most recent application continued the program for uninsured pregnant women with incomes from 142% through 195% of the federal poverty level. This is the same criteria that is used in the proposed extension application to continue this demonstration for an additional period. I do want to make one final note here, which is you will see two similar and equal indications for the income eligibility criteria of this demonstration. You may see it referenced as 142% through 195% of the federal poverty level. You will also see it referenced as above 141% through 195% of the federal poverty level. Well, these are slightly different. They are both implemented and equivalent. Section 1115 waivers, or Section 1115 demonstrations, are vehicles that states can use to test new or existing ways to deliver and pay for healthcare services in Medicaid and the Children's Health Insurance Program. Section 1115 of the Social Security Act gives the Secretary of Health and Human Services authority to approve experimental, pilot, or demonstration projects that promote the objectives of both Medicaid and CHIP programs. As of early July of this year, there were 55 approved waivers spanning over 43 states, with an additional 27 pending waivers in 21 states. Each Section 1115 waiver has at least one goal that is stated and furthers the goals and objectives of Title 19 and Title 21. The goal of Colorado's prenatal Section 1115 waiver is to provide necessary prenatal, delivery, and postpartum care to low-income pregnant women with incomes above 141% through 195% of federal poverty level. Each demonstration has stated goals, which are translated into additional objectives for the demonstration, and then are broken down into additional hypotheses, measures, and corresponding methodology used to assess the efficacy of the program in achieving its original stated goal. Colorado has set 3 objectives for this waiver, which have remained relatively consistent over time. The first is to decrease the uninsured rate for pregnant women. The second is to increase prenatal and postpartum care for pregnant women enrolled in the demonstration. The third is to increase the number of healthy babies born to pregnant women enrolled in the demonstration. To be enrolled in this demonstration, a client must be first determined to meet the program's eligibility criteria. For this waiver, the eligibility criteria within the demonstration are that it's open to uninsured pregnant women age 19 and over, and with a family income above 141% and through 195% of the federal poverty level. The demonstration is implemented statewide and will continue to be implemented statewide in the proposed extension. There are currently no enrollment caps or limits on the number of clients that may be enrolled in the demonstration, and that's planned and expected to continue in the proposed extension, or renewal period. For those enrollees that are enrolled into the demonstration, they receive all services that are approved in the CHIP state plan and Medicaid state plan, which both implement coverage in accordance to the minimum essential coverage provisions. For those enrolled in this demonstration, there's no cost sharing applied, which references their premiums or copays. Service delivery systems authorized under 1915A, Section 1915B, and Section 1932A of the Social Security Act are the areas the state provides services through within this demonstration. These are a combination of fee-for-service and managed care delivery systems. Upon full implementation of the proposed extension, as with the current active demonstration period, the department will provide health benefit coverage to those determined eligible for the demonstration using the state's fee-for-service and managed care delivery systems. Colorado is not requesting any program changes during the renewal period or in its extension application. And it is requesting an extension of the same waiver and expenditure authorities approved in the current demonstration period. These federal authorities would allow Colorado to continue to receive Title 21 funds for health benefit coverage provided to uninsured pregnant women aged 19 and over with family income above 141% through 195% of the federal poverty level. The two expenditure authorities Colorado is requesting waiver of are the minimum income standard for pregnant women in CHIP, which is found in Section 2112B2, and additionally, the CHIP secondary payer to Medicaid rule, which is found in Section 2105C6B. These two waiver authorities would authorize Title 21 expenditures for health benefit coverage to demonstration enrollees, and they would authorize this funding and expenditures, which is currently active, to continue in the renewal period of the requested demonstration application. The department completed an interim evaluation for the current demonstration period, which is also posted to the prenatal waiver public notice website, and it's available for public review and comment. The interim evaluation is framed in demonstration years. These are different than your traditional calendar or state fiscal years or quarters, which are more commonly noted. Demonstration years are tied specifically to a given demonstration, and they are presented for this demonstration in the table on this slide. In this case, the program was last renewed from August 1st, 2015 through July 31st of 2020, indicating a 5-year continuous demonstration period, which has individual demonstration years running from August 1st to July 31st of the following calendar year. This is a little bit confusing, and as you can see in the first row of the table on the left of this slide, demonstration year 1 runs from August 1st of 2015 through July 31st of 2016. Try to keep these in mind as I go through the interim evaluation results, because we will reference demonstration years which are slightly different than the state's fiscal year or the federal fiscal year. Additionally, I want to represent the 3 objectives that the state has targeted for this program, as we are going to discuss if they were met. To reiterate, the state targeted this population to achieve 3 key objectives: decrease the uninsured rate for pregnant women, increase prenatal and postpartum care for pregnant women, and increase the number of healthy babies born to pregnant women. In many researcher study designs, an intervention is applied to a target population and then compared against a control, baseline, or comparison group. In this demonstration, the comparison group is often referred to as the baseline population or baseline year, and it includes pregnant women with qualifying characteristics that gave birth during the calendar year of 2015. So that would be January 1st through December 31st of 2015. The intervention is thought of as the beginning or the start of the current demonstration period, which occurred on August 1st of 2015. The target group, or comparison group, is then the demonstration period, which is currently active for 5 years, starting from August 1st of 2015 through July 31st of 2020. The qualifying characteristics that are referenced in this table are outlined in more detail in the published evaluation report, as well as the state's approved standard terms and conditions and evaluation design. Both of these are posted on the state's website for this prenatal waiver application public notice period. But in summary, they include women with ages between 15 and 44 years old, incomes above 141% through 195% of the federal poverty level, with a service date being the date of delivery of August 1st, 2015 through July 31st of the following year, so in that case 2016. Additionally, they must have service codes indicating a delivery, prenatal, and/or postpartum care. One item I do want to note here is the 5 months of overlap between the baseline and target group. This is something to keep in mind as we discuss results, as it introduced bias into the evaluation and will be discussed in more detail later. As I indicated previously, the objectives of a given evaluation are often broken down into hypotheses with corresponding measures which drive the evaluation design to determine the efficacy of a given demonstration. For this waiver, there were 2 hypotheses developed. The first is that the proportion of pregnant women enrolled in the CHP Plus demonstration will have a statistically significant increase in prenatal care visits and a statistically significant increase in postpartum care visits over the 5-year demonstration. The second hypothesis is that the proportion of babies born to women enrolled in the demonstration and admitted to the NICU will decrease over the 5 years of the demonstration project. Additionally, the proportion of babies born to women enrolled in the CHP Plus demonstration that weigh under 2,500 grams will decrease by 10% over the 5-year demonstration. These 2 hypotheses were broken down into quantifiable measures, which include these 3 measures presented here. The first measure, measure 1, is that the number of pregnant women receiving prenatal care will increase compared to baseline. This measure was not met or supported and the interim evaluation findings. It will be discussed in more detail on the next slide. Measures 2 and 3 were met as forecasted by the state's hypotheses and expectation. Measure 2 was that the number of pregnant women receiving postpartum care will increase compared to baseline. Finally, measure 3 is that the percentage of births weighing less than 2,500 grams will decrease by 10% or more from baseline over the 5-year demonstration. The demonstration success in achieving the stated objectives is described and detailed extensively in the interim evaluation report. That report suggests, in summary, that the demonstration was partially successful in meeting its objectives, having shown favorable results for 2 of the 3 measures, which would be measure 2 and 3 above. The hypothesis that more pregnant women would receive prenatal care during the demonstration period as compared to the baseline, however, was not supported by this study's evaluation. Presented here, you'll see a graph of the percent of eligible clients receiving prenatal care by year. And again, this references back to measure 1. This is the measure that was not supported by the study findings. The highest percentage of prenatal care you can see by year on the left, which is the baseline year. This is our comparison group. Each demonstration year, which follow to the right, do not go as high on the graph, indicating a potential decreasing trend across all demonstration years for women receiving prenatal care. The state, had it met this objective, would have shown, and you would have seen in this graph, that each subsequent demonstration year would have been above the baseline or comparison group percentage, so above 50% in this graph. Of note, it is important to interpret these results with caution due to limitations in the evaluation design, which I've discussed in brief up until now. More specifically, however, there were challenges in capturing the rate of prenatal care which emerged due to changes in the way that data was collected across demonstration years. Additionally, there was frequent refinement of prenatal variable definitions, which prevented an assessment of the presence of any secular trend within the demonstration period. These refinements and definitions were most prominent around 2016 and 2017. Additionally, the combined overlap between the baseline demonstration periods, which includes 5 months of overlapping time, introduced variability and potential bias to the evaluation results. For the future evaluation and for discussion, the state plans to address these deficiencies. It plans to do so in the renewed period of the demonstration application and has several items which are presented within the application document itself and designed and developed further in the interim evaluation report, but in summary, outline methods and approaches the state proposes to take to ensure that a valid study design is implemented in the renewal period that's being requested. This will include limiting variability in the way prenatal metrics are defined across the demonstration period. This approach will clarify the prenatal findings from the present demonstration while keeping the same program parameters that are currently in place. Additionally, The department intends to use a regional benchmark as an additional external comparison group to compare future demonstration projects against. This aim is true for both the prenatal care metrics as well as the other metrics such as low birth weight, which were met but are components of this demonstration. Included in the application are more detailed tables and information on projected enrollment impacts and forecasts of enrollment figures for the waiver. Presented here is one table that outlines the projected CHIP enrollment figures for the state, assuming that the requested demonstration extension is approved. Colorado has what is called the Combination CHIP program, and this is a program in which states receive federal funding to implement both a Medicaid expansion and a separate CHIP program. You will see these referred to in this table. The combination of the separate CHIP plan, the Medicaid expansion plan, as well as the demonstration population will be the far right column in this table. The combination of those three then make up what is called the state's total CHIP enrollment. These are presented by year in this table, as well as in the demonstration application, and they're presented so that the state may present an impact assessment and forecasts of different scenarios for consideration with this demonstration application, such as, in this case, if the demonstration is approved, what will CHIP enrollment for the state of Colorado look like, and how will it be impacted by the demonstration? Alternatively, what would it look like if the demonstration application for extension was not approved? There are several scenarios which are discussed in the application, but in general, as you can see in the far right column here, the state is forecasting a median enrollment of 2,313 clients per year for this demonstration. The purpose of this meeting is to provide stakeholders and interested parties an opportunity to learn about the demonstration and ask questions or provide comments to the state. This is part of the transparency requirements of Section 1115 demonstration applications. Today, this is the second public hearing held by the state. Again, it is being done virtually to respect the limitations on social gathering needed for the public health emergency. The first public hearing was held on July 15th. The demonstration application, the interim evaluation that we just discussed, are both posted online at the state's prenatal waiver webpage. That is the link presented on the screen. Additionally, on that webpage, you will find further information and links to CMS's website in which you can learn more about general waivers, the process for waivers. You will also find a link to historical information dating back to 2002 for this demonstration, as well as our comprehensive and abbreviated public notices. This website will be maintained throughout the public comment period, as well as the application and implementation period, assuming that the extension request is approved for this demonstration. One component of the transparency requirements that I have just discussed, as well as another aim of this meeting, is to provide the opportunity for public comments. Comments must be received for this demonstration application and public notice and comment period by August 10th, 2020. They may be submitted in a variety of mediums. They can be submitted in person, or rather virtually, during this meeting. They may be submitted by email at the email address which is presented on this slide and also listed on the state's website. They may be submitted by mail to the department's office, which is also listed on this slide. One item that is traditionally presented during a public hearing, as well as throughout a public comment process for a Section 1115 demonstration or waiver application, is paper documents. If you look online at the state's website, you will see that the documentation presented there is rather extensive in length, and paper applications would traditionally be made available during all public hearings and made available for viewing and comment at the state's office. Unfortunately, due to the public health emergency, we are not able to present paper documents during a virtual meeting or present them at our office for individuals to come and access. To address this, there are instructions presented on the state's website that describe how an interested individual may request a paper copy of any or all application and supporting materials to be sent to their given address or requested address. Upon receiving a request, documents will be presented in paper format to the individual at their home, business, office address. They will be mailed out as quickly as possible. Instructions to request these include a telephone number, the email address presented above or here on this slide, as well as faxing or contacting the state's office. The fax number, telephone number are both listed on the state's website, as well as the point of contact, which would be myself. And any individual may request paper copies following the conclusion of the state's public comment period. A final application will be submitted to CMS for this demonstration. Included in that final application will be the incorporation of all public comments that have been received by August 10th, as well as responses to those comments by the state. Depending upon the substance of a given comment or concern, the state will have to address and will address that comment not just in response, but also incorporate that into their application document. Once all of those items have been completed, the final application will be considered as submitted for completion to CMS. Upon determination that the application is complete, CMS will start a 30-day federal comment period for the state's requested extension. After the conclusion of that federal comment period, and if deemed appropriate and acceptable, CMS and the state will conduct waiver negotiations on the extension provisions requested to extend the state's waiver authorities. After this, assuming approval, the state will then begin to develop and submit an iterative monitoring and evaluation design for further development and review by CMS. This, once defined and approved, will be submitted as the updated standard terms and conditions for the extended demonstration period. At that point, that will conclude the waiver application and evaluation design development for the requested extension of this program. At this point, I'd like to go ahead and stop and open up the floor for anybody that would like to make a comment, has a question, or would like to go back to a given area in the presentation. I am going to open up the slide deck such that you are able to navigate on your own in the event that you want to access previous material. And so again, I want to remind everybody that there are multiple ways to submit comments or questions to the state. They don't have to be submitted today or in this forum. I've presented my contact information. If you want to submit a formal comment or question to the state regarding this waiver application, I would ask that you use the second email address above, which would be the prenatal demonstration email address, or access and follow the additional steps to submit by mail, fax, or alternate method, which are designed and stated at the stakeholder webpage for the prenatal waiver application in CHP+. That is the final address or webpage listed here on this slide. That will conclude my presentation. I will remain here on the line available for comments, as well as for anybody who joins the public hearing late. This line will remain open and meeting available until 1 p.m. this afternoon. Thank you all for joining and for listening.
Hi, this is Shanti. I'm from Stride Community Health Center, and I just wanted to say that this has been a really important program for us, as we do see a fair number of patients accessing prenatal and postpartum care who are in that federal poverty level. So it has been greatly appreciated from our perspective, and we are in support of continuing with an additional waiver time period. Thank you.
Thank you. I appreciate your comment and greatly appreciate you engaging and putting time aside to talk with me today. All right. We are at 1 o'clock. We are scheduled to close, then adjourn this public hearing today at 1 o'clock. I would like to thank everybody that helped assist with this meeting. And with that being said, I'd like to call this meeting to a close.